Hi, I'm Rachel Kejigiran. I'm the technician here at LiveCare. Today I'll be interviewing Dr. Howard Koseff, the head of general practice here at LiveCare. Dr. Howard Koseff is LiveCare's first telemedicine family doctor. He leads the general practice division and has mentored GPs and specialists on effective telemedicine healthcare delivery. He is also an advocate of preventative medicine and a natural non-processed lifestyle and is known as Dr. Mindbody. He also has a book coming out soon called Power Up, Transform Your Life and Health in 14 Days. Dr. Koseff, why did you choose to start using telemedicine for your practice?
Thanks for the question and thanks for the intro, Rochelle. Basically, my lifestyle at the moment is one in which I travel quite a lot, and telemedicine enables me to see patients and continue practicing medicine despite being away and not in Vancouver. So that was one of the main reasons. The other reason is that telemedicine offers a fantastic way to keep on the cutting edge of technology. And I'm very happy to push the boundaries of medicine going forward into the next century.
Perfect. That's amazing to hear. Well, in your experience, are patients receptive to telemedicine?
That's a great question. You know, initially what happens is some patients are a little bit fearful and feel a little bit uncomfortable with the telemedicine interview and telemedicine experience.
Right.
But usually within one or two patient exposures to the telemedicine system, they feel very much at ease and comfortable. And in my experience, most, if not all, patients are very comfortable doing telemedicine. What is interesting is that younger people take to it like it's something they've been doing for years and have absolutely no hesitation whatsoever.
Right. Wow. What has your most memorable experience with telemedicine so far?
You know, I've had a lot of very pleasant and good experiences with telemedicine. One of the things being that through our system, we're able to actually make a diagnosis using our remote peripherals, such as stethoscope, otoscope. We're able to look at skin lesions and skin concerns, and even a simple thing like looking in a throat close up and get really good medical images. But I can tell you a couple of the memorable telemedicine encounters I've had was I had a patient in rural British Columbia, thousands of miles away from where I was, who was having an asthma attack. And what I was able to do is through our electronic stethoscope, listen to her chest, make an accurate diagnosis, and get her on the exact medications she needed. And the experience for her was really a good one, and we turned her around, and she was very happy. I'll tell you,
amazing.
I'll tell you one more really good patient encounter. I had a patient again in a rural community who was having some chest pain, and if she hadn't been able to see me via telemedicine, she would have had to get in the car and drive about 1.5 to 2 hours to access an emergency room, which would then have taken her many hours. Either way, what happened was I was able to use our stethoscope. I was able to use our electrocardiogram, make sure that she wasn't having heart-related disease. And I was able to reassure her and give her appropriate treatment and saved her a lot of discomfort and wasted hours traveling to the remote emergency room. So that was another memorable experience.
Wow, that's just great. That's amazing. Well, I know you have a strong belief in nutrition and preventative medicine. How do you help patients in this regard?
Okay, so thanks for asking that question, and I'm also very glad at the top of the interview you mentioned that my new book is coming up.
Yes.
Basically, I've co-authored it with my wife, who's a chef, and the book is a way in which people can transition from unprocessed and unhealthy food to, sorry, from processed and unhealthy food to clean and unprocessed food.
Oh, wow.
So I believe that nutrition is really very much one of the cornerstones of our health. And perhaps the best way I can explain it to you is that, you know, if we give our body clean food, then the body can burn clean energy. And if we do that, we can be healthy, we can stay healthy, we can replenish what we need, we can use all the antioxidants, etc., in good, clean food to replace and get rid of all the toxins that we come across on any given day. The other thing is that clean food does actually give us all the macronutrients, the micronutrients, the vitamins, the minerals, the antioxidants, all the good stuff that the probiotics, all the good stuff that our body needs to stay healthy. I'll tell you one other thing about nutrition that I find really important, and that is, you know, one used to think, or we used to believe, that your genetic makeup was your genetic makeup and you couldn't change anything about it. Well, even though that is kind of true, there's a new field of study called epigenetics, and epigenetics is beginning to actually show us proof that what we do in terms of nutrition and sleep and exercise can actually change the way our genetic information expresses itself. So if you have, for example, a propensity to have a specific disease, you can actually make an alteration in that. You can actually change that by optimizing your food. So for me, nutrition is crucial, and in any patient interaction, I always bring that knowledge that I have and that very firm belief that I have to the patient encounter. So I want to just, maybe if I can just say one more thing about telemedicine. You know, the bottom line in any medical encounter is that you want your doctor to be knowledgeable and caring. And it doesn't have to be a face-to-face encounter. It could even be a telemedicine encounter. So that's what I certainly do when I practice medicine with live care on telemedicine, and try to ensure that all the physicians that we offer on live care do exactly the same thing.
Amazing. I completely agree with you. I completely agree with you. Well, to learn more about Dr. Howard Koseff and his views on mind-body medicine, visit his blog at www.drmindbodyisin.com and www.powerupplan.com.